any of you has an urgent question to put, because it's, I think it's rare that we have this occasion to have these panelists all together here, which already means something, because it means that, that in fact, I mean, we have an alliance today in order to see what can be done for the future of vaccination and immunization. Everybody's so shy? Yes.
Professor Paolo Rossi.
Since we are recording.
I'm Paolo Rossi. I'm a pediatrician and immunologist and also member of the PDCO in London. First of all, I thank you all for this very interesting morning. We heard a lot about vaccination, and most of all, we are pleased that there is a focus on this very important problem today. I have only 3 points that I would like to draw your attention. One is about to vaccinate chronic diseases. I am a pediatrician working with primary immunodeficiency, HIV, patient with transplantation. So I think that of course the major debate here is on the general population, but I think this special population deserves very important focus for 2 reasons. First of all, although they are the object of many attention, I think that we do have very little evidence how vaccine work in this population. We have very little scientific evidence of what are the best endpoints, immunological endpoints in this population. So my question is to all of you, if there is any kind of focus in European research to develop this knowledge, because I believe that this will foster our understanding in this specific population that, I remind you, is a growing population in our industrialized countries. The second is more a kind of organizational point. As a PDCO member, I have been evaluating a number of vaccines and for the pediatric investigational plans, especially influenza vaccines. And I think a major problem is to have a European calendar, because every country has a different calendar. And this is very complex to evaluate a new vaccine and even old vaccines in the context of this complexity in Europe. And the third point, just to throw you another point of discussion, is, I mean, I believe that Italy in the last 2-3 years has witnessed a major problem related to migration of people from the south of the world. And I think that although we have done a lot of work, very little has been done to understand how much we could do to, especially for children, I'm talking about children, how much we can do to see, for example, how many of them are vaccinated, how many of them come with a full vaccinated schedule, and without breaking their right of being accepted, which is my major concern. I think we should work more on understanding their status, vaccination status, because otherwise we will see many of these outbreaks that we have seen, the doctor from EDC has shown. We will see it in the future. So these are 3 points of discussion just to throw to you today.
Which roughly means another 3 days of meeting. I think we can split among us the vaccination of chronic diseases. I hope one answer may come from the e-health. Some answer may come from the e-health if we are able to collect data on those chronic diseases affected people. Maybe it's one way at least to start and to have some. for the European calendar, I think we handle to John. And from the immigration, we handle to the Minister of Health as soon as she will be back in the, and maybe also to ECDC.
So just on these 3 points, first of all, on the issue of chronic diseases, the Commission will be launching a policy on chronic diseases in Europe, and I'm afraid at the moment that vaccination does not play a preponderant role in this draft policy document, which focuses more, I would say, on prevention and management of chronic diseases, looking particularly here at diabetes and cardiovascular disease and cancer. But I think there is a place there for a higher profile for vaccine-preventable diseases in that policy. What you were referring to were specific groups in the population who may have specific issues in relation to vaccination. And I would say that there is a mechanism within the Horizon 2020 program where if you have a good idea for a gap in knowledge in relation to public health, the Commission is extremely open to receiving those ideas. We have meetings every day with researchers from around Europe with ideas for research. So I'd invite you to put your ideas on paper or come to see us, and we'd be very happy to organise a meeting on that. On the second point in relation to the European calendar, we tried about 4 or 5 years ago to propose a childhood vaccination recommendation. This was a piece of soft law. And the recommendation was based on having 2 elements. First of all, a record, a common European record of vaccines so that people could, in an equal way, travel around Europe with a record of the vaccinations they had had. And secondly, to put together a more harmonized approach to a calendar. Now, I remember when we were presenting during the Hungarian presidency, we were presenting our ideas to the ministers, and my commissioner took out of his pocket his dog passport, because you know there's a European dog passport with the stars on the front and the name of the dog and all the vaccination record for the dog. And he said, well, if my dog can have this passport, why can't my child have this passport? So some of the ministers laughed and thought it was a good joke, but in fact, we were still attacked. We were attacked by the member states, basically, who said this is a question of subsidiarity. You know, in Austria, we have a great electronic record for vaccination, and somewhere else gave another example, and we don't need a European system. So we're still at this status quo there in terms of a vaccination record at European level. And there are many examples. My own is one where countries have no effective system in place for allowing somebody to know what vaccination they've taken in their childhood. So this is a gap which we hope we can address as part of coming back to this issue of vaccination in a new strategy. And the third issue is, sorry, just on this calendar thing before I finish, when we investigated the European calendars, many of them were based on historical national considerations, including national production of vaccines. So they don't really have the same basis in science as a modern approach would have. And therefore, I think member states are a little bit nervous about opening of all of this Pandora's box up for public examination. That was my feeling. On the issue of migration, during the Greek presidency last year, it was earlier on this year, we had a discussion on migration and health, in particular focusing on communicable diseases, and one of the conclusions was that we should set up a working group at European level on screening of migrants for communicable diseases. It will go a little bit further than that. It will look also at screening for other health issues, and not only looking at children, of course, but also at adults. Now, that hasn't made a great deal of progress because of the Ebola situation at the moment, but we are hoping to come back before the end of the year to establish this group within the Health Security Committee, because some countries are applying TB screening, others are not applying TB screening. I would say, from my knowledge of the information which was given to us during the Greek presidency, the Italians have a rather good system in place, and do carry out, at least on paper, a good entry screening process. Now, how that's followed up when migrants enter into the bloodstream of Europe, shall we say, is different. So that's one of the challenges we have, because we know that migrants who are entering Lampedusa, for example, don't stay in Lampedusa, they go elsewhere. And this is one of the challenges we have, how to track these people and to try and give them the support they need as part of our healthcare systems.
Yeah, thanks. No, just a brief one, Professor Rossi, on the European calendar. I think John addressed very well the aspect related to the subsidiarity, to the way as public health policies are implemented at national level in Europe. That's one element that has always been struck. I'm not thinking never to a one European calendar, but there are levels of harmonization that most probably can be achieved in order to improve, that are naturally linked to the free circulation of people. As you said, people circulated, more or less they should have the same level of immunization throughout the territory of the Union. Something that, and that maybe I reverts the call, because you belong to leading scientific society, is the level of strong different views on the type of vaccination. It's very scientific, it's very technical, but if you look throughout Europe, the different debate how it's spread out, for instance, on the pertussis component, the value of 2, 4, 5, or whatever in pentavalent or hexavalent vaccination. All the debate on varicella vaccination. There are countries like Germany that have a routinary, well, in other countries is really considered a matter of scientifically strong different views. So I think that there is a work that needs to be done also to support, to achieve that goal at the level of scientific society. We need a sound, harmonized scientific views on the value of immunization, of vaccination, in order to then make the call most probably for an harmonization in terms of administrative harmonization. Just a thought. Huh?
Sure.
I would like to add a point on the different vaccination schedules in Europe. Although there is a great variation, a lot of work has been done in the past 5 years towards a kind of more homogeneous approach. In 2005, for instance, we started from the situation in which we had for DTP, we could have from 3 up to 12 doses, varying in member states. Now we are in a very different scenario. So I think we are naturally moving towards a more aligned schedules. And this is important also because co-administration play a role in vaccine effectiveness.
Okay, I think there is a lady there. You have already the microphone, and then
two other. One, then one.
Two, and 3. Okay.
Right. Thank you very much for giving me the word. I'm Hildrun Sunset, and I represent the European Institute of Women's Health, and we're also a member of the European Public Health Alliance. So my question here, I mean, first of all, congratulations to the Italian EU presidency for bringing up this very, very important topic that vaccines, immunization is part of a major component of public health. This is really great because we feel for years it has been neglected. We have concentrated, and very laudably, on the chronic diseases. There are many for every disease now in Europe. Practically, you have a patient organization supporting them, but you have no advocacy or from the civil society, let's say, not only patient groups, because you're talking about the whole population in a way. The population has not been aware of this, we haven't had the political leadership. Each country has been left to do their own thing. So really, we're very excited about this. We want to thank you very much. But now I have immediately a question. I think Peter and I are the only representative of civil society here. So we're already very fortunate. I paid for my own trip because I thought this was very, very important. But I think if you create this, and I'm very pleased what John Ryan said, that we're going to have a European strategy. Very, very important. But how will you bring civil society on board and include the people who actually should know about vaccination, not just the professionals, but also the society at large? And how do you create health literacy about vaccination in the general population so they will know, understand what herd immunity is, that if I don't take my child for vaccination and we don't get this 95% coverage for measles vaccine, we endanger the whole society. So this is my big challenge to you. Okay.
Thank you very much. Maybe we can have the other questions and then we'll answer. Was it? No?
National Institute of Health here in Rome. Is that working? Yes, it is. From what we heard, it is clear that the question is not limited to a specific point. I'm sorry for this. Now is any better? May I shout? No, I mean, the question is clear that it is not a technical problem, it's not only limited to a specific sector. And therefore, what I would like to underline is that we do really need, for such a cultural change, a sort of intersectorial approach, like for gaining health in different areas. And I think that the idea of involving the schools and also the medical education, because I mean there is limited exposure of those studying for becoming doctors to the concept of vaccination beyond the usual hygiene discipline. And having also such collaboration with the schools where people is trained and must be used to this concept with the medical staff, and building up this trust on vaccination is something which should be done going outside of the usual of the regulatory agency, producers, and only public health people. And this should be done also at the highest level of European Commission, probably with such an effort. And my second point is that I appreciated very much what has been said by the representative of the patients at the very last of his speech, which was the request for independent studies, not manufacturer-sponsored. We are used that those who request a licensure they have to bring the proof of what they want to sell. But it is not enough for the trust of the people, and therefore we need to have also a strong publicly funded research on this. And unfortunately, this is not the case at the moment.
Hi, I'm Pamela Logan from the Pharmaceutical Group of the European Union, representing 400,000 community pharmacists across Europe. The Minister this morning said that we need to look at new and additional opportunities for vaccination. And back in 2011, the Minister for Health in Ireland did just that when he introduced new legislation to allow pharmacists to supply and administer the flu vaccination. So for the regulators among you, the flu vaccine is still prescription only, but pharmacists can supply and administer it without a prescription. In the first season that we vaccinated 9,000 people. The second season, 18,000 people. Last season, 40,000 people. And we would hope to vaccinate a lot more this season. Chronic disease, people with chronic diseases are a key target for flu vaccination, and pharmacists see these people once a month. So we're ideally placed to get involved in a flu vaccination campaign. We've collected information from pharmacists who vaccinate in Ireland, and what we do know is that of the people that are vaccinated in pharmacy, 25% of them have never been vaccinated before. And out of that 25%, 85% of them are in an at-risk category. So that's how you improve and improve the access to flu vaccination, certainly. Pharmacists in Portugal and the UK have also started to get involved in flu vaccination. And I do think when it comes to the EU consultation in 2015, it's something that we should encourage in other member states as well.
My name is Petra Falb, Austrian Medicines Agency, and I have just 3 comments. The one is on the first question regarding the vaccination for chronic disease or special conditions, because in Vienna, since 2 weeks, it's very new, there's a special ambulance working with vaccination for people with chronic disease, cancer patients, pregnant women. So it's quite new, of course, they have no experience so far because it just started, but I'm sure if you are interested in contacting them or sharing information, so I'm sure they are quite interested. The head of this ambulance is the head of the Austrian Vaccination Committee of the National. I'm also a member of the committee. I'm kind of linked between the regulatory activities and the vaccines in context with public health. The second comment is regarding the regulatory activities, because as Professor Razi already mentioned, it's a very complex area, a very complicated, maybe boring area for people not working with that. But I think it's maybe it could be a good idea to provide more transparency, because patients and also medical doctors, they have very strange thinking about how regulatory activities are done. So they have just, maybe we just paid from pharmaceutical industry, or we just get some nice small books and say, yeah, it's okay. But it's a very complex field, and maybe could be a good way to bring more transparency for the public in that. And the third remark concerns the veterinary vaccines, because I'm also a veterinarian from education, so Austria is a small country, so everyone has to cover lots of issues. It's regarding the emergency vaccines, because of course that's a quite important issue also regarding humans. If you use unauthorized vaccines, for example, in an emergency situation, because there are lots of risks for humans, for animals, for the environment. And I also represent Austria in the Immunologicals Working Party for Veterinary Medicinal Products, and there's no new concept paper, position paper, I don't know if it's already published, but it deals with exact these questions, because the medicine authorities, of course, are not the decision makers to use such a vaccine. It's the Ministry for Health or any public health office. But of course, they come to the Medicines Agency to ask, is this safe? What are the risks? And so it's just to be aware of that this exists, and maybe could be quite helpful in such a question. Thank you.
I think the questions are... one more? Okay. This is the last, so we can have the time to reply. Thank you.
I think it's very interesting. It's like a relay, you know. In terms of generating informed demand and for recognizing outbreaks, particularly around measles, are changing. And the stress and the focus on adolescent and younger adults and life course approach vaccination we particularly applaud, of course. I wanted to just make 2 points at this point, which is I think the more we know about vaccine hesitancy in Europe, the more we have to acknowledge that there is a lot of social copying going on. That people, the majority of people who vaccinate their children, do not necessarily make some smart, long-winded, informed choice about this. They vaccinate because other people are vaccinating. And that makes our immunization programs extremely vulnerable. And it makes them vulnerable to just, in some cases, very few anti-vaccination lobbyists or voices that are out there. So I wanted to really stress the point that was made earlier by the Minister regarding education in schools and the importance of anchoring the next generation in their beliefs. Because there's too much sway of the majority at the moment. And I'd like to prompt the Italian presidency to pursue this further and to really look at how we can bring vaccination, as we have done successfully with tobacco, sexual and reproductive health, alcohol abuse, into the schools, into the classrooms, so that the future parents can be better informed and hopefully be able to make better informed and balanced choices. The second point I wanted to make has actually been brought up by the lady from Ireland, which is I would definitely prompt more discussion on the convenience of vaccination. The vaccination offer that we make to parents today is not the most convenient. We're delivering vaccines now. Vaccine programs are delivered between 9 to 5. They're delivered through only certain health settings, with the exception of 3 member states who are now testing pharmacy delivery. I would really want to emphasize the importance of looking at this convenience C. I have 3 C's of complacency, convenience, and confidence. And I feel complacency and convenience, complacency and confidence we've been discussing a lot. But this convenience factor and how we can make the vaccination offer easier, I think is something that is, at this point, not very well addressed. And I speak on behalf of WHO as well when I say this. So I wanted to make that point and for us to move beyond the notion that if we build this, they will come, and that informed individuals are the behaviorally responsive ones, because it's not always the case. Thank you.
Thank you very much. Very, very important intervention that the last to seal a little bit the meaning of what we have said today. I think we have no real time to comment. I will list the question and the comment with a very brief comment, and then I will suggest to address specifically remaining issues during the lunchtime. So we also will be lighter on the meal if we talk more about this problem. No, going in rapidly, one very important issue has been raised about the civil society advocacy of vaccine. I think that is an important call. I will take personally for what is the limited remit of EMA, but I will do my best to have that. We know that the voice of patient and civil society is the most powerful today, and is the only one credible so far, because we are in some way biased. And I address, I take on this the transparency. You might be aware of the strong fight that EMA had about transparency. I'm proud of what we achieved. Is enough? I don't know. Certainly the culture is there, but the credibility not yet. So with your help, we might achieve both. And that is partially responding to what you say. Yes, we in the regulatory world, whatever we do for good is because we are too close to the industry. Whatever we do for bad is because we are bureaucrats, we don't understand. So, as my colleague Peggy Hamburg said, we have only 2 speeds, too low and too fast. One other very important comment is about the independent studies. IFA had a tradition on that. I hope they can go back. And I hope that Europe can support and encourage and join in this approach for the independent research. Regulatory driven, because most of the questions are post-marketing, regulatory specific questions that can have quite an easy answer. We learned the hard way in Italy that was not interpreted as a beginning from that. Vaccination non-prescription, I think from WHO has been already addressed. It's a good example. I think we have to, the 3C, I think we have to keep in mind is a very, very important thing. It depends a lot of the health environment where you operate. So you have to have the structure, you have to have the knowledge, but it's a way. It's an expansion, certainly it's an interesting one. And we have to maybe to learn from who already run that experience, how it works, and what could have been done better, and what can be done exactly as it is now. Education in school, I don't comment this. I know that there will be some specific experience this, I think is the key. In school and beyond, from starting school, meaning any level of school, we know that, at least in Italy, pediatricians are good enough. Many doctors are those who are against vaccine. And for an immunologist is very sad to say, but since we want to conclude on a very positive note, I think here we have listed so many key actions. We basically agree, now we have to act. And maybe with some good food we can act even more energetic soon after. Thank you very much for your attention. At 1:30 here, just housekeeping. So keep light and talk a lot.